Hi, my name is Stephanie Russell, and I am the supervisor for the CFI Clinical Determination Unit within DHHS. In this module, we will be covering Community Transition Services. In the HEE 801 rule, the definition for Community Transition Services outlines the criteria for the service. This means a non-reoccurring service, which includes case management, to support CFI participants who are transitioning from an institutional setting or another provider-operated living arrangement to a living arrangement either in a private residence in which the participant is directly responsible for his or her own living expenses in accordance with the HEE 801.17. Within the CFI waiver, the service definition is more detailed and highlights the options for this service to be implemented. It's important to note that the service can be used for when people are transitioning from a residential setting or an assisted living setting and can be used multiple times throughout the year as needed. Some of the expenses that are covered under the Community Transition Service would be security deposits, setup fees or deposits for utility services, items required to occupy and use a community docile, such as essential household furnishings, window coverings, household appliances that are being needed for basic food preparation, and bed and bath linens. This could also include a one-time cleaning done prior to occupancy, such as pest eradication. Under the Appendix K for the public health emergency, the cap in the old waiver of $1,500 still in rule was temporarily lifted to $2,500. In the new CFI waiver that went into effect July 1st, 2022, the service limit is now $3,000, and this cap can be exceeded. Services must be prior authorized by DHHS and are limited to $3,000 per person per transition. This limit is independent of other service limits, and the payment of a security deposit is not considered rent. Within the HEE 801 rule, the information of the waiver is mirrored in terms of the detail for transition services. Some of the following shall be covered expenses under the Community Transition Service. So again, a security deposit for an apartment or house, setup fees or deposits for utility services, which could include telephone, electricity, heat, and water, items required to occupy and use a community domicile, such as household furnishings, window coverings, appliances, bed and bath linens, services that are necessary for the participant's health and safety, such as pest eradication and the one-time cleaning done prior to occupancy. And it shall not include monthly rent or mortgage payments, food, monthly utility expenses, or costs for household appliances or items that are intended for entertainment, recreational, or diversional purposes or use. At this time, the enrolled case management agencies who have enrolled for the Community Transition Services effectuate the Community Transition Service by either making the purchase or deposits needed, either via submitting authorization requests or submitting an authorization request with receipts for purchases made in order for them to receive reimbursement. For more information on community transitions, please go to the website newhampshirecarepath.dhhs.nh.gov.